But what I've heard, I think more from this side of the table earlier, was what is the right milieu to do this kind of research? Is it an academic center? Is it a clinic? In other words, where does the real world come into this? It's one thing to do a double-blind controlled study at a large metropolitan tertiary care center. It's quite another to do this in somebody's private office. So where's the best place to look at this? Where is the place that's most responsive to the uptake of all of this information and then utilizing it?
I think we all have roles. I mean, I think if you look at the academic institutions, they can assign themselves a role. And I think one of the things that each of us is going to have to answer is what questions are we asking, and really put a fine enough point and make sure it's measurable enough for us to be able to look back and say, this answers the question that we were asking. And I think that there are other institutions that I'm seeing that are beginning to say, academic or otherwise, are beginning to say, now we've got information of our own, let's do our own analysis and begin to feed that information back to our clinicians and to the system of care and be able to identify the variations and outcomes that we weren't expecting so we can rank order those to solve.
All right. And
I just want to say, I think it's not as important what the site of care is, though the site of care often determines the operational ability to deploy the metrics, get the metrics back, have the dialogues. What's important is for some agreement on what those metrics are. And you touched on earlier how the involvement of specialty societies, ASCO and others, is key to being able to move the whole country forward in a lot of quality forums. Because once people somewhat agree on where we want to go, then as Brian said, we can roll this out in various sites and then we can get down to solving the real questions.
All right, it's not the site of care, it's the site of kinds.
Well,
let's hope. Now, there's patient-reported outcome research, right? There's PROMs, and they're being advocated as a means of improving care. So my question is, have they been observed to improve patient outcomes, process outcomes, and they may be distinct, and healthcare service outcomes in cancer treatment?
Well, I don't really know in cancer treatment how good this has been because I think we're on the early side of this. Okay. I think it's too soon to tell. I can tell you that patient-reported outcomes can be a little bit tricky depending on how you deploy them because, for example, if you ask patients their satisfaction with their oncologists, we have some early information about that. They love their oncologists. So there's very little variance there, and variance in that response, if you take a population, may not be because of something that the oncologist did. It may be some other factor. And I can tell you in the insurance world, when in the Medicare space you have to use consumer assessment of health plan satisfaction, CAP surveys don't do a very good job of telling you who's a good insurance company and who's not. So you got to be careful about how the tool is designed and laid out because that will be the determinant of how you want to use it and how good the utility is.
The other challenge has been that there really hasn't been a methodology to collect the information. What Ira has described as largely aggregate reporting. That's not really what we want. We actually want individual level reporting so that we can tie that to other clinical factors and specifically outcomes. So that technology does not exist today.
I think you're both right, though. I think there's a pattern analysis, and I agree with you. I think and I'm going to take what you said earlier, I think we need to look at the outrageous and learn from that rather than the affirmation. I'm not sure what we get out of, everybody's a great doctor versus what's wrong and what's wrong with the system and what was wrong in the way that I experienced the healthcare delivery system.
Everybody likes their congressperson, but nobody likes Congress.